Welcome, everybody. I am Dr. Cheryl Abayo-Jones with the Morehouse School of Medicine Masters of Public Health program. For years, I've been working with health professionals and teaching in the field of women's health and sex differences. And I've received many professional and personal inquiries regarding how to find information on women's health and sex differences. Today, I would like to present you the second learning module on women's health and sex differences, Health Information Resources. The project is funded by the National Library of Medicine and aims to increase both the health professionals and the health consumers' awareness of the availability of authoritative and reliable health information resources through the National Library of Medicine and the National Institutes of Health web portal. Researchers, clinicians, and professors who are interested in the topic of women's health and sex differences will find this learning module particularly beneficial. As from this learning module, you will learn how to reach, navigate, and utilize some important online health information resources. You will learn how to find the latest research results in the field, NIH priorities, and NIH grant and contract opportunities. This information will serve to enrich your biomedical endeavors. I would like to introduce you to the leadership team. The project director is Dr. Roland Bernard Wellmaker. The other team members include Dr. Virginia Floyd, Dr. Cheryl Abayo-Jones, Mr. Joe Swanson, and Dr. Jinji Zen. This module focuses on women and breast cancer, a disparate health condition among African American women. We are using this condition to demonstrate how to use the web portal to find authoritative, credible health information, journal literature and citations, and NIH grant and contract opportunities. Many searches for health information often begin with Google or some other search engine that often yields a multitude of resources with wide variations of authority or credibility. However, using information databases established and maintained by the respected scientists, physicians, librarians, and information specialists of the National Institutes of Health and the National Library of Medicine is highly recommended. I am with my colleague Mary, an expert searcher of National Library of Medicine databases. She would like to share her experiences in working in a medical school library with the NIH Women's Health Portal and the information needs of clinicians, students, professors, and researchers.
I'm Mary White. I'm on staff at the Morehouse School of Medicine Library and Information Services. I'm a teacher of online medical resources, a searcher, and trainer. It is my passion to help people help themselves. But today is a special day. It allows me to share with you something that is dear to my heart, women's health. Today, I will tell you about Dr. Jones' research on a specific health topic. One professor, Dr. Jones, informed me that she desired to develop grant proposals and needed to find additional journal articles and citations related to breast cancer and African American women. She was especially interested in problems related to diagnosis. I took her to a website that is authoritative, frequently updated, and easy to understand, a National Institutes of Health, National Library of Medicine web portal that focused on women's health. The NLM NIH web portal is divided into 6 areas: health topics, NIH priorities, A through Z index, news and events, NIH research funding, and featured topics. Health topics leads to information about such topics as cancer, diabetes, exercise and fitness, military, and women. NIH priorities provide information about the year's theme for priorities for research in women's health. The A through Z index is the alphabetical listing of the web portal's topics from abortion to weight loss. The NIH research funding points to the NIH guide and information for grants and contracts from chronic fatigue syndrome to maternal nutrition and pre-pregnancy obesity. While featured topic is just that, Information access to such areas of interest as gestational diabetes, heart disease, chronic obstructive pulmonary disease, COPD. We began our search by clicking on cancer, which is listed under health topics on the left of the screen. We also could have chosen health topics or A through Z index on the blue bar beneath the web page title and logo. If we had chosen health topics, then we could have chosen cancer from the alphabetical list. Now that we find the cancer page, let's look closely at what is outlined. First, we found there was information for the person interested in clinical trials. Under clinical trials, there were clinical trials about different types of cancer: breast cancer, cervical cancer, ovarian, and vaginal. Some were specific to women, while others had no gender boundary. There was also information that could be gathered from Medline Plus, the Consumer Health Information Resource, NIH National Cancer Institute. But near the bottom of the list of resources was PubMed, the resource for biomedical journal, literature, and citations. When cancer was clicked under PubMed, it was indicated that there were over 3,000 sources or citations found. The number of sources per page, filtered for narrowing the search, were located in the left margin. Search details the type of terms used in relation to the established medical subject heading, or MESH. Display settings, the format, the items per page, and sort by, which can be changed by clicking on the adjacent arrow. Send to destination is the file, the collection, the order citation manager, clipboard, email, or bibliography, and which can be determined by clicking on the adjacent arrow. The NCBI account registration is saved to your searches for future retrieval. Registration is free. Click on My NCBI, create a username and password, and then register. Here you are able to customize your home page. Checked items will appear on your My NCBI homepage. Unchecked items will not appear on your My NCBI homepage. Note that the number of hits or the sources found were too numerous and needed to be limited. Therefore, we narrowed our search by first being more specific in our search terms. Instead of cancer in general, we use breast neoplasm and triple negative in the search box. When breast neoplasm and triple negative were searched, it indicated that there were over 1,000 sources or citations found. The number of sources per page, filtered for narrowing the search, were located in the left margin. Now, although there were specific sources found, the number of hits were still very numerous. If desired, the search could be limited in terms of publication, dates, language, article type, and/or species. We decided to retain this search, but saved it so that we could retrieve it without having to perform this same search again. We also wish to be informed of future journal articles on triple negative breast cancer. Therefore, we saved this search in my NCBI account for later retrieval. As a researcher and clinician, Dr. Jones learned how to use the Women's Health Portal to search for journal articles, how to establish an account with my NCBI, how to limit a search, and how to save a search.
Today you learned how to use the Women's Health Portal to search for journal articles, how to establish an account with my NCBI, how to limit a search, and how to save a search. We hope that this learning module assists you in your future research and teaching endeavors. If you should need further assistance, please contact the MSM Library at librarians@msm.edu. Thank you.